So again, this is Saeed, and welcome back. So now we reach to episode, I think number 11, and all this presentation is done from one book by the title Handbook of COVID-19 Prevention and Treatment. This is one experience of one hospital. It's called Zaing University Hospital, where they deal with 104 positive patient, COVID positive patient, and among them around 74 intensive and critical care and severe cases. Now, and there was no death reported till this moment, and of publishing the book, and there was the most importantly there was no staff was infected, so which indicate that they have very strong system. That's why I like to share with you this experience, and I share this experience as it is. I will not put any other reference, only depending on this experience. So now we reach to this psychological intervention and rehabilitation therapy for COVID-19. Psychological intervention with COVID-19, the physiological, the psychological stress and symptoms of COVID-19 patient. Confirmed COVID-19 patients often have symptoms such as regret and resentment, loneliness, and helplessness, depression and anxiety, phobia, irritation, sleep deprivation. Some patients may have panic attack. Psychological evaluation in isolated ward demonstrated that about 48% confirmed COVID-19 patients manifested psychological stress during early admission, most of which were from their emotional response to stress. The percentage of delirium is high among the critically ill patient. There is even a report of encephalitis induced by SARS-CoV-2, leading to psychological symptoms such as unconsciousness and irritability. Patient mental status, individual psychological stress, mood, sleep quality, and pressure should be monitored every week after admission and before discharge. The self-rating tool include self-reporting questionnaire 20 SRQ 20, patient healthcare questionnaire PHQ 9, and generalized anxiety disorder GAD 7. The peer rating tool include Hamilton Depression Rating Scale (HAMD), Hamilton Anxiety Rating Scale (HAMA), Positive and Negative Syndrome Scale (PANSS). In such special environmental the isolated ward, we suggest that patients should be guided to complete the questionnaire through their cell phone. The doctor can interview and perform scale assessing through face-to-face online discussion. Principle of intervention and treatment. For mild patients, psychological intervention is suggested. Psychological self-adjustment include breathing relaxation training and mindfulness training. For moderate to severe patient, intervention and treatment by combining medication and psychotherapy are suggested. New antidepressant, anxiolytics, and benzodiazepine can be prescribed to improve the patient mood and sleep quality. The second generation antipsychotics such as olanzapine and quetiapine can be used to improve psychotic symptoms such as illusion and delusion. The recommendation of psychotropic medication in elderly patient, middle E or elderly COVID-19 patient medical situation are often complicated by physical disease such as hypertension and diabetes. Therefore, when selecting psychotropic medication, the drug interaction and their effect on respiration must be fully considered. The recommended using of escitalopram to improve depression and anxiety symptoms. benzodiazepines such as estalozolum, alprazolam to improve anxiety and sleep quality, olanzapine, quetiapine, etc. to improve psychotic symptoms. Severe and critically ill patients suffer from different degree of dysfunction, especially respiratory insufficiencies, dyskinesia, and cognitive impairment during both acute and recovery stage. Rehabilitation therapy. Now we'll talk about rehabilitation therapy for COVID-19 patient. Rehabilitation therapy for severe and critically ill patient. The goal of early rehabilitation intervention is to reduce breathing difficulties, relieve symptoms, ease anxiety and depression, and lower the incidence of complication. The process of early rehabilitation intervention is rehabilitation assessment therapy reassessment. Rehabilitation assessment based on general clinical assessment, especially function evaluation, including respiration, cardiac status, motion, and ADL, should be emphasized. Focus on respiratory rehabilitation assessment, which include the evaluation of thoracic activity, diaphragm activity, amplitude, respiratory pattern, and the frequency. Rehabilitation therapy. The rehabilitation therapy of severe critically ill COVID-19 patients mainly include position management, respiratory training, and physical therapy. Position management. Postural drainage may reduce the influence of sputum on the respiratory tract, which is especially important to improve the patient VQ patient V over Q. Patient must learn to tip themselves into position which allow gravity to assist in draining excretion from lung loops or lung segments. For patients using sedative and suffering from consciousness disturbance, standing up bed or the bed head elevated 30 to 45 to 60 may be applied if patient condition permit. Standing is the best body position for breathing in a resting state, which can effectively increase the patient's respiratory efficiency and maintain lung volume. As long as the patient feels good, let the patient take standing position and gradually increase the time of standing. Respiratory exercise can fully expand the lung and help the excretion from pulmonary alveoli and airway expel into the large airway so that sputum would not accumulate at the bottom of the lung. It increases the vital capacity and enhances the lung function. Deep, slow breathing and chest expansion breathing combined with shoulder expansion are the two major techniques of respiratory excretion. Deep, slow breathing. While inhaling, the patient should try her best to move the diaphragm actively. The breathing should be as deep and slow as possible to avoid the reduction of respiratory efficiency caused by fast, shallow breathing compared with thoracic breathing. This kind of breathing needs less muscle strength but has better tidal volume and V over Q value, which can be used to adjust breathing when experiencing short of breath. Chest expansion breathing combined with shoulder expansion. Increase pulmonary ventilation when taking deep, slow breath. One expand his or her chest and shoulder while inhaling and move back his or her chest and shoulders while exhaling. Due to special pathological factor of viral pneumonia, suspended breathing for a long time should be avoided in order not to increase the burden of respiratory function and the heart as well as oxygen consumption. Meanwhile, avoid moving too fast. Adjust the respiratory rate to 12 to 15 times per minute. Active cycle breathing technique. It can effectively remove branch excretion and improve lung function without exacerbation of hypoxemia and airflow obstruction. It consists of three-stage breathing control, thoracic expansion, and exhalation. How to form cycle of breathing should be developed according to the patient condition. Position expiratory pressure trainer. The pulmonary interstitium of COVID-19 patient has been severely damaged. In mechanical ventilation, low pressure and low tidal volume are required to avoid damage to the pulmonary interstitium. Therefore, after the removal of mechanical ventilation, positive expiratory pressure trainer can be used to help the movement of excretion from the low volume lung segment to the high volume segments, lowering the difficulty of expiration. Expiratory position pressure can be generated through airflow vibration, which vibrate the airway to achieve airway supporting. The excretion can then be removed as the high-speed expiratory flow move the excretion. Physical therapy. These include ultra-short wave oscillator, external diaphragm pacemaker, electrical muscle stimulation, etc. Thank you very much. And next episode, we will talk about lung transplantation of COVID-19. Although in this hospital, they did not do anyone, but this is their recommendation if it's needed. And the process of discharge standard follow-up plan for COVID-19, and if the patient die, what to do. Medical advice. Also, we will give three example of medical advice. Example for COVID-19, for example for mild, moderate, severe, and critical COVID-19. Thank you very much. Please share with others and register. Thank you very much. See you next episode.